Well, imagine someone making a medical decision for you, who's never been your doctor and has never even seen you. That is exactly what local doctors say is happening across the country, though, and they're becoming more and more frustrated by it. Insurance companies are choosing which drugs they will and will not cover, even when a patient has used the drug for years. Well, now doctors are fighting back.
April Campbell's 16-year-old daughter, Corey, was diagnosed with rheumatoid arthritis when she was just 10 years old. She's been on Enbrel ever since she was diagnosed, and it seems to be working.
She's, cranky and fussy, and she's just never happy when she doesn't have it because she's hurting. But when she has it, she's a very happy child.
April switched over to the Oregon Health Plan a few months ago. Her plan chose not to cover Enbrel any longer.
We've had periodic difficulties with insurance companies keeping her on this medication because it is expensive.
Enbrel could cost insurance companies $15,000 a year. Dr. Bill Meyer has treated Corey since she was a young girl. He says this drug has done amazing things for her.
The medical directors decided that she needs to go back to a medication she was never on, which is an inexpensive medication that is less effective and has many more side effects than the Enbrel. These clinical guidelines are supposed to guide physicians in making appropriate choices, not for insurance companies to deny medications that doctors feel are necessary.
Why go into the doctor if the doctor's judgment is not taken into account?
Dr. Cody Wasner agrees. He says he spends a third of his day just trying to fight for coverage for medications for his patients.
We've got people flying the plane who have never flown a plane. They're sitting on the ground reading a manual and saying, I think you ought to do this.
Helen Sherman with Regents RX says with the cost of health care rising, they have to make choices in the health plan benefits they offer. She says they consult a panel of doctors before those choices are made.
There are conditions that need to be met to get coverage for Enbrel. It goes back to what does the science tell us, what's the logical order of choices based on that science.
But for doctors like Bill Meyer, it's personal.
It's true the medications are expensive, but it's sort of my obligation to make sure patients get the best medicines no matter what their cost.